the Honorable MEC Nomakhosazana Meth, Her Worship the Mayor, Councillor Mama Tidi Mafumbata, Chief Baleni, the District Manager Umama Mtonjana, Mandinbulu Senonge, good morning. Our media briefing colleague, let me greet you all this morning and thank you for attending this media briefing. With us, we have SABC TV and radio, we have the Informa newspaper, we have Pondo News, we also have media houses that are joining us virtually as follows: the Herald newspaper, Media 24 and Daily Maverick. We're also broadcasting live in our community radio stations through the hub, Alfred Nzo FM, Vukane FM, Danzane FM, Konjane FM, Gubela FM. Without wasting time, let me hand over to the MEC to brief us this morning. Over to you, MEC.
Good morning to all our partners from different houses today. Honorable Mayor, Chief Baleni, the GM, Mr. Shiji, for the Wild Coast Sun Resort, and the people of the Eastern Cape. We'll be focusing just on 3 issues: the Women's Month, progress on vaccination rollout, and resurgence plan against COVID-19. For a second year running, Women's Month celebration in 2021 take place under the dark cloud of the SARS-CoV-19 pandemic. The pandemic continues to wreak havoc in the lives of all our people, leaving destruction of lives through death and semi-permanent disability caused by the long COVID-19 disease. It also impacted negatively on economic activity, with the brunt of this being borne by the most vulnerable in our communities. To date, over 2 million South Africans have been infected with the COVID-19 virus, causing over 12,000 deaths. Women, as usual, have been the most affected by the effects of this deadly virus and its multiple impacts. This adds to the already challenged context wherein women struggle for transformative action towards the realization of our constitutional ideals of gender equality and human rights. According to the statement of the UN's Executive Director for Women, Dr. Phumzile Mlambo-Ngcuka, I quote, "During the pandemic, the world saw an increase in acts of violence against women and girls, and lost learning for girls as school dropout rates, care responsibilities, and child marriages rise." Close quote. Closer home to South African Police Services reports during the same period confirmed these trends as the order of the day, especially during hard lockdown. Our country faces what in essence has been described by our country's president, His Excellency Matamela Cyril Ramaphosa, as a second pandemic, that of gender-based violence. With our government having declared 2021 the year of Charlotte Maxeke, that the gallant champion of women's equality and the right to universal suffrage, inspiration can be taken from her life story. The key question is, what can we draw from that courageous leader of our people to inform what needs to be done today? What can help us to adequately respond to the effects of COVID-19, gender-based violence, poverty and unemployment that inflict so much pain on our women? As historians have recorded, Mama Charlotte Maxeke achieved astronomically for a single woman at the highest point of patriarchy in our society. She obtained several accolades, the most notable of which includes that she was the first black woman in South Africa to graduate with a university degree, obtaining a BSc at an international university college from the United States of America. She was a trailblazing leader of women's emancipation campaigns, including demands for every adult person to vote, particularly Africans and women, and the list goes on. It is for these reasons that we make women's leadership and representativity the focus of our 2021 celebrations. Research has demonstrated over and over again that women as leaders of households, communities, cities, nation states, and world bodies have driven up the World Development Index. In my department, our focused activities to celebrate women is on healthcare workers in terms of psychosocial and spiritual upliftment of women in particular. Initially, this will focus on those who were infected and affected by COVID-19. The Eastern Cape province has recorded an increase in COVID-19 cases over the past 7 days, with 4,886 new cases reported in the first week of August. This is 13% higher than the cases reported in the previous week at the end of July 2021. In the last 24 hours, the province has added 743 new cases of COVID-19. This brings the total number of active cases to 7,370, with a recovery rate of 91.4%. A large percentage of these cases come from Nelson Mandela Metro, Sarah Baartman, and BC Metro. Nelson Mandela Metro and Sarah Baartman have been showing signs of decline in cases, though we are starting to see a spike in cases, especially in Dr. Beers Nodie local municipality and sub-district B and C of the Nelson Mandela Metro. The number of deaths due to COVID-19 have declined slightly from 191 to 156 reported in the current week. The majority of these deaths are reported in Nelson Mandela Metro, Chris Hani, Joe Qabi, and Sarah Baartman. The province is very concerned with the trend of high mortality rate amongst those infected with COVID-19. Particularly, we are concerned about the high mortality rate in the rural districts such as Chris Hani, Joe Qabi, and Sarah Baartman, even including the post-mortem discovery of those who pass on being positive in Alfred Nzo district. The province is very concerned with the trend of high mortality rate amongst those infected with COVID-19. Particularly, we are concerned about high mortality rate in the right districts. I think I'm repeating myself. I'm sorry about that. A team of experts in the Department of Health, supported by World Health Organization and the National Department of Health, are conducting an analysis of the high mortality rate to determine contributing factors and make recommendations on reversing this trend. The department would like to encourage those at high risk of developing severe diseases, that is those with existing comorbidities like high blood pressure, diabetes, and other conditions, to seek health care early. We are ready to provide care to those that are more at risk, especially when they present early for care in our health facilities. We have been monitoring our hospital admissions, and we can now report a decline of about 6.6% from 469 to 438 admissions in the past 7 days. About 30% of the current admissions are on oxygen, with 15.2% on a ventilator. The majority of these admissions are in the public sector. We have stable supply of oxygen in all our districts, and we are monitoring stock levels daily in partnership with AFROX. It is encouraging to report that the number of COVID-19 hospitalizations amongst health workers who were vaccinated has consistently been far lower than in the previous waves of the pandemic in the province. Of the 163 health workers who contracted COVID-19, only 7 were admitted and were discharged after full recovery. This proves without a doubt that the vaccines available in the country are safe and effective in preventing severe COVID-19 infections and death. We have observed a new threat of our efforts to contain the spread of COVID-19. This has come in the form of outbreaks in schools that have been reported in Amathole, OR Tambo, Chris Hani, Sarah Baartman, Nelson Mandela, and BCM. At the last count, there were 89 schools that have learners who contracted COVID-19 in the past 7 days. We must commend the Departments of Health and Education for the swift response in managing the cases of COVID-19 in the schools. The team led by Office of the Premier mobilized resources to identify the index cases, locate their contacts, screen and test them, and activate the isolation and quarantine services where appropriate. In this regard, the department primarily uses its own facilities to isolate. We'll continue to monitor our capacity in hotspot areas that have been reported. The Department of Health has increased interventions on surveillance, screening and testing, and also the capacity to isolate and quarantine those at high risk. The Education Department has enhanced its prevention measures and infection control. Amongst other measures, the schools are encouraged to ensure that there is good ventilation, open doors and windows to ensure good air circulation in the classrooms. Must appeal to the communities to continue to comply with the non-pharmaceutical interventions. The outbreaks in schools cannot be viewed in isolation from the communities where they are located. The provincial government appeals to the community leaders and other stakeholders to ensure the observance of the COVID-19 regulations under Alert Level 3 as announced by the President of the Republic. The social gatherings, parties, funerals, and other mass gatherings that do not comply with regulations are a serious risk in the province. I was passing by, driving through Mbizana town. I saw people there in numbers without any masks. We all need to take individual responsibility to protect ourselves and our loved ones from this deadly virus, which is still ravaging the communities in our province. Though we have moved from Alert 4 to Alert Level 3, the risk of COVID-19 infection has not gone down. We still encourage people to avoid crowded places and continue to wear masks properly when in public spaces, wash hands or sanitize frequently, and maintain a physical distance of 2 meters when in public spaces. The province is now fully engaged in the vaccine rollout program, having breached the 1 million mark of registrations in the month of July 2021. As at 9th August 2021, increased registrations up to 1,173,577. We have also made significant progress in the registration of the 35 to 49-year group, as the province has registered 309,684, which is 27.9%, against the target of 1,109,157,000, with the highest percentage registrations reported in Sarabatman district against its own target population of 32.8%, which is 98,817. A total of 217,826 vaccines have been administered thus far for the age group 35 to 49 years. An increase in the number of registrations of 50 years and above has been reported, that is 246,123, which is 47.6%, against the target of 517,545 population segment. We are continuing to make progress among the age group 60 years and above. So far, the province has registered 526,573, which is 67.6%, against the target population of 778,894, with 51% vaccination coverage of the same age group, which represents an increase of 35% reported in June 2021. 3 districts and 1 metro in the Eastern Cape, namely Amatole, Buffalo City, Metro, Sarabatman, and Alfred Nzo, are amongst the 15 best performing districts in the whole country, with Amatole having registered 92% of the over 60 years population segment and highest in the country. As a province, we are observing a decrease in the registration of the age groups 50 years and above, as well as 60 years and above, and that has also affected the number of vaccines administered per day. I want to make a call to everyone to please come forward and register for vaccination. Just as a reminder, if you are using a USSD, please dial *134 *832 ID number # then dial. You can also use an internet access or data required WhatsApp by sending the word register to 06012345566 or visit website https://vaccine.enroll.health.gov.za. You can also register using a toll-free number on all South African mobile networks, 0800 029 999. I think we need to continue communicating these numbers because we are seeing our people now slowing down and even depending on our outreach teams and vaccination sites for both registration and vaccination. Because we've got a target to meet, we want to encourage our people to self-register and to also go to vaccination sites to vaccinate. The province is now recording over 25,000 vaccinations per day against the initially set protocol of 23,000 vaccinations per day. There is a decrease in the daily vaccinations as the province has been administering vaccines over 30,000 per day. The decrease is attributed to the constraints with the supply of vaccines during the week ending 31st July 2021. It is also worth noting that Afrenzo is making progress in the vaccination rollout program as they reported 92,553 vaccines administered on the 6th of August. The district is implementing outreach programs in the wards in order to ramp up vaccination. The limited stock availability meant that the scheduling for vaccination had to be changed and some outreach programs were not operational. The stock availability has already begun to show an upward trajectory, and since the beginning of August, all vaccination sites, outreach programs and pop-up sites are operational. Due to vaccine instability that is affecting the country, the National Department of Health has since revised the targets for all provinces. The Eastern Cape is expected to be able to administer 42,000 vaccines per day by the 31st August 2021. Remember, I had said to you, we are targeting 50,000 per day, but there's since been a review of that. In terms of the adverse events following immunization, most reported reactions relate to minor systemic reactions, your mild headaches, body aches, etc. The number of vaccine breakthrough infections was 163, and as at 6 August 2021, with only 7 cases which were admitted and discharged, as I said earlier on. Majority of the reported cases were from Nelson Mandela. I'm repeating that because I was first talking on COVID-19 resurgence. Now I'm on the vaccination, just to emphasize the point that with those individuals who have vaccinated, it is very minimal, the issue of infection, but also hospitalization. And we are still, for now, agreeing with the scientific reports that we rule out deaths if a person has vaccinated. So far, there has been no death linked to vaccination program. So even though we are saying there are vaccine breakthrough infections, there is not yet a reported vaccine breakthrough death. It's only infections with minor complaints. Once again, appeal to our communities to please come forward, vaccinate. As the above data is confirming the efficacy of vaccines and prevents any individual vaccinated to develop severe disease that requires hospitalization and possibility of death. In terms of the progress related to the mass vaccination sites, which are going to be funded by Solidarity Fund, the panel has been approved, and the next step is for the province to identify clinical operators who will oversee the operations of the sites. The 2 metros, that is BCM and Nelson Mandela Metro, are going to be funded by Solidarity Fund and will be operational by 31st August These sites are expected to administer 5,000 vaccinations per day. A proposal has been submitted to the Solidarity Fund through the Office of the Premier to fund another mass vaccination site for OR Tambo. A call has come from the Honourable Premier to VW for support in scaling up the vaccination program in the province. VW has identified Ketimpilo to implement this program in Sarah Baartman and Nelson Mandela. The sites are expected to be operational by 1st of September. A process of mapping up temporal sites like the pop-up sites with retailers, SASSA pay points, mobile and outreach sites is underway for the following districts: Amatole, OR Tambo, Jokabi, which will be funded by Solidarity Fund. And we are today in the Wild Coast Sun Resort, which is another extension vaccination site in partnership between our government, the Department of Health, and our private sector, the management of this particular resort. And we appreciate that very much. This program will address inequity in the health system by ensuring that health services are brought closer to the communities. Discussions have started with the Department of Education to use basic education vaccination sites and schools in preparation for the rollout of 18 years and above category. All universities and TVET colleges are being consulted to be used as vaccination sites for the university and college community. In conclusion, I want to repeat and say I am pleased to be here and acknowledge on behalf of our government the generous gesture and support of the Wild Coast Sun management by having agreed to host vaccination sites on its premises. This goes to show the social activism of business, which we hope will be emulated by many others whose support and involvement is encouraged. We need all to help our people, and we want all the help that we can get. The threat is still out there. We haven't defeated this virus yet. We need all to play our role. As government, we have put up the alert levels and encourage people to use the non-pharmaceutical interventions. As reported here today, you are also ramping up the vaccination program as part of preventing the severe consequences of COVID-19 infection. I thank you everybody for the attention, and thank you the media houses for being our partner in ensuring that at least every Tuesday of the week we talk to our people to address them on the progress we are making on both the COVID-19 resurgence management and the vaccination rollout. Thank you very much, Program Director.
Thank you, LSC. We will now hand over to the media houses, those that have questions, to please ask questions. Are there any questions? Are there any questions? I'll ask that you introduce yourself and the media house that you are from, and then you ask the question. Thank you so much. Is there any other question? If not, I'll hand over to you, Edison.
Asante. Unzima lo mbuzo ubuzayo. We're-scientist. But kuyabonakala uba ootata bayoyika isitofu. Phofu siyabazi. Basoyika isitofu. Izithetho ziyasibonisa uba there is more females who are vaccinated than males. In terms of efficacy of vaccines, both Pfizer and J&J. As I commented, xa ndiqala ukuphendula uba omnye umbuzo ufuna ii-scientists, but I think ii-scientists ziyithethile. Ii-percentages ziyohluka between Pfizer and J&J. But nangona zizohluka, asikaboni into ithi abantu abafumene enye yezi zimbini bona ba-vulnerable. Hence the reporter overall to say of the people who have vaccinated, if you remember in our province, we've used both. But as we are saying, we have not received any report on vaccine breakthrough that caused death. But we are reporting that abantu who have vaccinated, they get infected. But chances of being hospitalized are minimal on both Pfizer and J&J. So that's how far I can go with the response in terms of the efficacy of both. We trust our SAPRA, because remember, even though in terms of the World Health Organization, there is a particular assurance after many tests are conducted with the vaccine. But us also, as South Africa, we've got our own regulatory board, authority, SAPRA. Efike ke ngoku iphinde izenelise to satisfy ourselves ukuba ingaba nyani ezi vaccines are they safe to administer. For now, they've done quite a sterling job. So we are comfortable with the current arrangement.
Thank you, MEC. I take it there are no other questions. Are you fine, Sifundi?
Yeah, fine.
Okay. That means we've come to the end of our media briefing. We will then ask the MEC to have a one-on-one with the SABC for both Xhosa and English bulletin. Thank you all for attending the media. We come to the end. Thank you.
Thank you.